All right, next up in the Will It Work For Me series is about psilocybin therapy's effectiveness, specifically with clinical trials. So, I and my team have gone through hundreds of clinical trials so that you don't have to, right? Because there are major research institutions all over the world now. These are world-class institutions like Yale and Stanford and Johns Hopkins and Imperial College of London. I mean, these are very, very prestigious institutions who are currently doing psilocybin therapy clinical trials and have been doing them for years and years. So you could absolutely go out to each of these institutions or just do your own Googling of psilocybin therapy clinical studies or whatever. But you would spend, like we have spent, dozens and dozens of hours finding all of those. And so what this training is really meant to do, this particular episode, is really to kind of curate it down and compile a list of several psilocybin clinical studies, right, that I would like to share that I feel are representative of pretty typical results. So although there's been clinical trials in a huge wide range of topics, from anxiety to alcohol use disorder to anorexia, and now they're starting to do studies on cognitive decline like Alzheimer's. By far, the most amount of clinical studies have been with treatment-resistant depression. And you should know as well, I want to just throw out there before we get into the more recent studies, that before psilocybin was made illegal in the early 70s by President Nixon and put on the Schedule 1 controlled substance list, it was legal. It got introduced into the states in the 1950s, the United States. And from the 1950s through early 70s, there were over 1,000 clinical trials that happened back then as well, right? And then, of course, once it became illegal and it was put on the Schedule 1 controlled substance list, everything pretty much shut down for like just about, well, not quite 50 years, but for a really long time. So lots of clinical studies happening in like the late 50s and 60s. Then everything pretty much shut down. And then starting in the early 2000s, things started to kind of trickle back. And then I would say just since 2015 to this year, 2025, just in the last 10 years ago, 10 years, there has been another just huge surge in clinical trials because, even the federal government, even though psilocybin is still on the Schedule 1 drug list, the FDA, also a federal government agency, has claimed and has granted psilocybin as a breakthrough status in the treatment of treatment-resistant depression. So like even the federal government has openly and publicly said, yes, this is a breakthrough treatment. And at the same time, there are ongoing clinical trials. I think Compass Pathways is in phase 3 right now. And after those pass, it might be taken off the Schedule 1, but like there's a weird juxtaposition right now where it's still Schedule 1, which claims that there is no potential medical benefit, but at the same time, the FDA itself has said this is a huge potential therapeutic benefit. So that's where we live. That's the world we live in as of right now in 2025. But I can tell you that ever since the FDA did that and granted that status, there's been a lot more institutions that have begun spinning up clinical studies again. So I just want to share some of that history, and then let's just dive into some of the depression studies that'll be found. Okay, so thus far, overall, clinical studies have shown psilocybin to be approximately 2 times to 3 times more effective than SSRI medication in the treatment of depression in particular. Now, it's important to know that this is more like when people first start undergoing either therapy, right? This isn't for people who have been on Prozac for 40 years, for example. This would be like, okay, you're going to either start an SSRI or you're going to start psilocybin therapy fresh. And psilocybin therapy is 2 to 3x more effective than going through SSRIs. What we call the landmark study, that happened in 2020, and that was at Johns Hopkins. It was with only 24 patients, but we call this the landmark study because it's really what kind of opened the floodgates for further studies. In this study, with 24 patients, 71% of them showed a more than 50% reduction in depressive symptoms after 4 weeks, right? So sustained for a month, and 54% were in complete remission, right? So out of 24, that would have been what, 13 of the patients, they no longer had depressive symptoms after one session. So that was very, very exciting. Then in the next year, 2021 at Yale, with 30 patients this time, 60% achieved a complete remission of depressive symptoms at the 4-week follow-up. And then in this study, there was a 3-month follow-up as well, and the effects were sustained that long as well. And then also in 2021, I want to mention the Imperial College of London with 59 patients. This one specifically compared the efficacy of psilocybin therapy versus a popular SSRI, Lexapro in particular, for depression. And they found that 70% of the psilocybin group showed a clinically significant response compared to just 48% of the SSRI group. And so in this particular study, they revealed psilocybin to be roughly 50% more effective than one of the most commonly prescribed SSRI medications. In 2022, a study at the University of Zurich, so continuing with our international theme here, this had 58 patients. In this study, 65% of the psilocybin group were in complete remission at the 8-week follow-up compared to just 25% in the placebo group. And it's important to note that this study also had talk therapy, so that placebo group was actually getting talk therapy as well. In the FDA phase 2 clinical trial that's been happening over 3 years and involving 11 different sites, this has been led by USONA Institute, I think that's how you pronounce it, with over 100 patients, 104, I believe. The psilocybin group has demonstrated a rapid and sustained reduction in depression severity, 42% of reduction in severity, compared to the placebo group, which was just 11% at a 6-week follow-up. And finally, going back to 2021, again, this is the largest study that's been completed to date with Compass Pathways. It involved 233 patients. 67%, so 2/3, showed a clinically significant reduction in depressive symptoms versus 32% with the placebo group receiving talk therapy only. Rapid remission was observed at 3 weeks, and then it was sustained at the 3-month follow-up as well. Now, there's a special note about this trial that they also tested 1 milligram and 10 milligram doses, and those were basically not effective. They were not effective. They had to go with a standard dose of 25 milligrams to achieve these results. That's important for you to know because usually with psilocybin, the consciousness altering threshold for most people in which you get completely different experiences is around 10 to 15 milligrams. 12 to 15 milligrams. So 25 squarely puts you up into the consciousness altering realm, and in which, what we talked about in the prior video, the limbic system and the default mode network, it's all being acted upon. 1 milligram and 5 milligram and like even up to 10 milligram doses, those are going to have a much milder effect, and you are not going to feel like you are in an altered state, and therefore the changes to the brain just aren't as pronounced as with a larger dose. Okay, and then how about psilocybin versus ketamine treatment? We get asked this a lot. Psilocybin is, in the short term, studies are showing roughly as effective as ketamine in the reduction of depressive symptoms. But in the longer term, psilocybin is showing a lot more sustained results after just 1 or maybe 2 treatments or sessions versus ketamine. And so this makes the average annual cost and the time investment more efficient, higher ROI treatment than ketamine in most cases. And it's also important to note that psilocybin does not elicit addictive or dependent properties as ketamine sometimes can. Okay, let's talk about clinical trials with other clinical trials with psilocybin therapy. So I won't go into all of these that I have listed here in this document in detail. I am going to share the transcript, but I did want to share some of the curated trials and data available. And I'm going to make this available to everybody taking this training so you can read through it and review if you feel like doing even more of a deep dive. Let's talk about anxiety for a second. These studies, the studies I'm about to mention, they show really promising results for psilocybin in reducing generalized anxiety symptoms, right? With reductions in anxiety ranging from 45% to 60% on average over follow-up periods ranging from several weeks to several months, okay? So let's just go through a few of those. There was a study in 2023 and carried over into 2024 in Australia at the Monash University. There were 72 participants, and the results was that 85% showed a statistically significant benefit, right, for psilocybin treatment compared to a placebo. 85% with generalized anxiety. There was a Compass Pathways study that was held at multiple sites across the USA and Europe in 2023. There were 216 participants in this. And in this study, they reported a 52% reduction in anxiety symptoms at the 3-month follow-up for participants receiving a single dose of psilocybin, compared to a just 24% reduction from the placebo group that received talk therapy alone. There was a University of Zurich study as well in 2022 and 23 with 100 participants. And this showed a 45% reduction in the severity of anxiety symptoms that was held over up to 6 months, right? That's when they did the last check-in with this crew, compared to just a 20% reduction in the placebo group. And then finally, we'll go back to NYU at the Langone Health facility. This was in 2023. There were 90 participants. And this study also showed a 60% reduction in anxiety symptoms at the 6-month follow-up for those who received psilocybin once, compared to a 25% reduction in the placebo group who was only receiving talk therapy support. Okay, those are some results for anxiety, generalized anxiety. OCD is under the umbrella of anxiety as a separate anxiety disorder, so I'd like to talk about that. This has had smaller amounts of participants. So there's a University of Arizona study. This was back in 2006 with 9 patients with OCD, and they experienced what they considered a significant reduction, anywhere from 23% to 48% in OCD symptoms during at least one of the sessions, with effects that lasted far beyond the treatment period. Okay, so that's one. Also back at NYU, this was in 2016 with 10 participants. They experienced a 45% reduction in OCD symptoms at the 1-month follow-up. And then most of those participants maintained improvements for up to 6 months. Back to Imperial College of London, this was a 2019 study, 15 participants with treatment-resistant OCD. The study reported a 30 to 40% reduction in OCD symptoms within 1 week of treatment, and significant reductions were maintained at the 3-month follow-up. Let's see, and then back to Johns Hopkins, also in 2020, there was 18 participants in this study, and the study found a 30% average reduction in OCD symptoms at 1 month that also had sustained improvements over a 3-month period. And then finally, at Monash University in Australia with 73 participants, they actually had more than 1 dose of psilocybin. It was administered weekly for 8 weeks, which feels very intense to me. But anyways, that was the study. They had a significant reduction in OCD symptoms. There was a 44% response rate, and 27% achieved full remission, which I think is really just profound. Now, I wouldn't always recommend doing weekly sessions over 8 weeks, but in this particular study, that was what their outcomes were. Okay. Okay, and I think that is about it in terms of the OCD. I do also want to go through 2 that I've found that are great for alcohol use disorder and smoking cessation. Psilocybin has really shown potential in treating various forms of substance abuse, right, including alcohol and tobacco dependence. We have also seen clients at our center for other types of dependence, like we saw one person who had a sugar addiction, for example. So it's not always substances. So let's go through those. So this was back at NYU. This was with 10 patients who had alcohol dependence, and they showed a significant reduction in drinking behavior, with many participants maintaining low levels of alcohol consumption and reducing their heavy drinking days up to 9 months post-treatment. And then let's see, sorry, that one was in 2015. NYU did another one in 2022 that was much larger. It was 93 men and women, both a mix with alcohol dependence, and they found an 83% reduction in heavy drinking days after 2 sessions, compared with 50% who received psychotherapy alone, and this was sustained 8 months after treatment. 48% stopped drinking entirely versus just 24% who received psychotherapy sessions alone. At Johns Hopkins University in 2022, there were 95 patients with alcohol use disorder, and the psilocybin group had a 20% reduction in heavy drinking days compared to the placebo group, and this was observed over a 24-week follow-up period. At Yale University in 2023, 80 individuals with AUD, alcohol use disorder, there was a significant reduction in the percentage of drinking days by almost 20% was observed in the psilocybin group. And this was also over a 26-week period. At the Imperial College of London in 2023, 60 individuals with AUD, they showed a 25% reduction in the number of heavy drinking days compared to the placebo group over a 20-week follow-up period. Okay, and let's see. Finally, at the University of California, San Francisco in 2023, there were 25 participants, and these showed a 40% reduction in heavy drinking days and a 30% reduction in overall alcohol consumption over a 12-week follow-up period. And then I do want to just mention, that was mostly with alcohol. I do want to mention tobacco as well. This was back in 2014 at Johns Hopkins. There were 15 patients with significant tobacco dependence, and they showed an 80% abstinence rate. I know this was only with 15 people, but 80% abstinence rate that was sustained at 6 months, right? And so this is obviously significantly higher than traditional treatment success rates. So that is just a little bit about some of the power of what we are seeing in the clinical study world with psilocybin across a variety of mental health conditions. I do want to just mention that, and we're going to get into this in the next training video, our center is actually seeing in general even more positive results. And we believe that is due to a few different things, one of which is that we have a 9-facet success model that we take every client through. And one of these facets of success is the complete customization and personalization for each client, including their dosing and their dosing needs, that people going through clinical studies just don't get, right? And so I'm going to go through that in the next section, but I at least wanted to share some recent, within the last decade, most of which have been in the last 3 years, so very, very recent studies, so that you could just get kind of a sense of what we're seeing in the clinical trial and clinical study world. All right, I'll see you in the next video.